Welcome to the Explainer. Okay, let's talk about testosterone therapy. For many, it's a life-changing treatment, but there's always been this one big question hanging over it. Is it safe for your heart? For years, the science has been all over the place. But today, we are digging into a brand new study that adds a critical and, frankly, pretty concerning new piece to that puzzle.
So here's our game plan. We're going to start with the basics. What's the promise of this therapy and why is it so common? Then we'll get into the back and forth history of the hard safety debate. After that, we'll dive headfirst into this new long-term study, unpack its pretty surprising findings, and then put it all into context to figure out what this means going forward.
All right, first things first. To really get why this is such a big deal, we have to understand what this therapy is actually for.
We're talking about a condition called hypogonadism. And simply put, it's when the body just doesn't make enough testosterone. It's a problem that gets way more common as men get older. And its effects? They go way beyond the bedroom. We're talking impacts on everything from your metabolism and bone health to your overall mood. And look, for men who actually have this condition, the benefits of getting treatment are, well, they're undeniable. We're not talking about small tweaks here. We're talking major improvements in sexual function, bone density, energy, mood, you name it. And that huge impact is exactly why it's such a common treatment. But, and this is a big but, despite all those clear benefits, one massive question has been hanging around for years, and it's created a real headache for doctors and patients. Is it safe for the heart? Honestly, the scientific story here has been a total roller coaster. If you go back to 2014, some early studies really set off alarm bells, suggesting a higher risk. But then, more recently, these huge, really well-done studies, like the Testes meta-analysis and the big Traverse trial came out and seemed to calm everyone down, finding no significant risk. That is, until now. And that brings us to this brand new clue. A recent study was built to ask a slightly different question. What happens not in the perfect, controlled world of a clinical trial, but out here, in the real world, over a much, much longer time? Researchers in Glasgow basically turned into data detectives. Using national health records, they looked back in time, they found a group of men who'd been on testosterone for at least 2 years, and then watched what happened to them over the next 5 years, comparing them to a massive group of similar men who weren't on the therapy. Now, here's a really crucial detail if you want to understand the real-world part of this. See, unlike some big trials that only look at one specific product, this study captured the whole mix of how testosterone is actually used. You've got injectables, gels, patches, the whole shebang. This gives us a much more realistic snapshot. Okay, so with all that set up, we get to the main event, the core finding. And this, my friends, is where the story takes a very sharp turn. Right, this is the million-dollar question, isn't it? After sifting through all those years of data from thousands of men, what did they find? Is there a link between using testosterone long-term and your heart health? The answer was pretty stark, a 55% increased risk. And let's be super clear about what that means. It's a 55% higher chance of having what's called a major adverse cardiovascular event. We're talking the scary stuff, heart attack, stroke, heart failure, for the guys who are on long-term therapy compared to those who weren't. And the really crucial point here is that this wasn't some borderline, maybe it's something result. The hazard ratio was 1.55. And for you stats nerds, that confidence interval doesn't even come close to crossing 1. In plain English, that means this finding is statistically significant. It wasn't just some random fluke in the data, it points to a strong measurable association. Okay, hold on. This seems to completely contradict those big, reassuring trials we just talked about. So how can one major study find no risk while this new one finds a 55% increased risk? Well, as is almost always the case in science, the devil is in the details. Even the study's authors point this out. You just can't compare these studies like they're apples and apples. The differences in how they did the research are absolutely fundamental to understanding why they got different results. And this chart just lays it out perfectly. The Traverse trial, that was the gold standard. A randomized, controlled trial. But it only looked at one kind of testosterone gel, and the guys in it were on treatment for less than 2 years. This new Glasgow study, on the other hand, was observational, but it captured much, much longer real-world use. We're talking over 8 years on average, and it included all sorts of different formulations. They were literally asking different questions in totally different ways. So what on earth does this new piece of the puzzle mean for the actual patients and doctors who have to make decisions about this stuff every day?
Well, the study tried to dig a little deeper, and it hinted that maybe not all testosterone therapies are created equal. The link to heart problems was statistically solid for things like gels and patches, but for injectables, while the risk was still higher, the connection just wasn't strong enough to be considered statistically significant in this particular analysis.
Now, before we all panic, it is absolutely vital we remember what this study can't tell us. Because it was just looking back at data, it can only show a link, an association. It can't prove that testosterone caused these heart events. They were looking at prescription records, not whether the guys actually took the meds. And they couldn't account for other huge factors like smoking habits, obesity, or a person's actual testosterone levels.
So the real takeaway here isn't that those earlier trials were wrong. It's that this new evidence adds a really important cautionary note about the long-term picture. It's a huge hint that what happens over many years of messy, real-world use might be a very different story from what we see in a clean, 2-year clinical trial.
And that puts patients and their doctors right back in the middle of a very tough conversation. It's this ongoing challenge. How do you weigh the very real, proven benefits that can dramatically improve someone's life against a potential long-term risk that, honestly, we're still trying to get our heads around? The science is still evolving, and you can be sure this debate is far from over.